Yeah. Do you have any projections or estimates for the number of people who you would like to be covered by this new the publicly provided health insurance? Have you costed that out? Where would that money come from?
We are calling for health insurance programs that meet certain principles. There are lots of different ways to use those principles. There are different kinds of programs that can do that. So we're not backing particular programs or particular legislation at this point. So I can't give you cost estimates about how we're going to pay for it. But I think the key thing is we want to be paid, costs to be shared. They should be paid for by tax dollars, by employers, by employees, and everyone should be able to pay on the basis of their income.
Are you following any existing model? I mean, the state of Massachusetts, for example, has a system of health insurance which I believe requires everybody to be covered. I mean, is that what you're aspiring to?
We haven't taken any position on mandates right now, and that again remains to be developed as the legislation actually gets developed. And we're not really basing on any pre-existing model. I think this is a new model that draws on the experience of other countries, but really tries to find an American path to providing quality, affordable health care to everyone. One that's going to be, at least initially, a mixture of a strong public sector and a heavily regulated private sector. Yes?
What's your assessment of the Rendell plan and where it's at and what's been happening with that? How effective?
Well, as some of you may know, I've been part of a coalition that's been working for something similar to the Rendell plan that the House Democrats in Harrisburg have come forward. You know, that's a step forward. It's sort of along the lines we're talking about, but it's clearly will not insure everyone. And I think one of the things we've learned from our state experience is that ultimately we need a national solution. And that's why many of the people, John Myerson from the SEIU, AFL-CIO, Nancy from the City of Philadelphia, ACORN, Philadelphia Unemployment Project, and Action, we're all part of the statewide effort, but we're also committed to a federal solution. And that's why we're here today. Because that's really where the ultimate solution is going to cover everyone has to come.